And we are live. Good morning. Kalimera, everybody. Welcome to Voice AI Insights, a special podcast series powered by Kalimera.ai. In our previous episode, we explored how AI is transforming the way we communicate, and especially how multi-agent AI systems are redefining communication. Today, in today's episode, we will focus on one particular industry where trust, accuracy, and empathy are of paramount importance. Any guesses which industry I'm talking about? You're right, you guessed it, it's healthcare. So today's episode is titled The Voice of the Future and How AI is Transforming Healthcare, and especially voice AI agents. I'm your host, Chryssa Skodra, and today I have two distinguished guests to open up this topic with me. I have Professor Pavlidis with me, Stefanos Pavlidis, and Dr. Haris Savidis in the studio with me. Welcome, gentlemen.
Good morning, good morning.
Kalimera. Good morning.
Kalimera. Thank you for joining me in today's episode. I'll briefly say a couple of words about you. Dr. Stefanos Pavlidis, he is an internationally recognized biomedical scientist and an entrepreneur in the healthcare sector. He specializes in clinical diagnostics and preventative medicine. He holds a PhD in genetics, and he's leading clinical laboratories at Vioiatriki Group in Cyprus. He is a pioneer in patient-centric healthcare innovation, and he is a voice, a thought leader in his field, as he has more than 55,000 followers. He is a man who understands the science, the research behind healthcare innovation, and he's in that intersection where he is able to communicate the messages quite clearly for a variety of audiences. So stay tuned for the first segment. Dr. Stefanos Pavlidis is opening the impact of voice AI in healthcare and why it matters, what problems it solves. And then we have Haris Savidis. I can say briefly now in the introduction, and then I'll go a little bit deeper in his background during segment 2. So Professor Haris Savidis, he is a practicing lawyer, member of the Cyprus Bar Association, and a university lecturer at the University of Nicosia. He is an expert in digital innovation law, GDPR, financial regulation. He has also served as an expert member of the EU Blockchain Observatory and Forum, advising the European policymakers on digital assets framework. So we'll cover with him legal frameworks, the legal principles, and he's the man who will tell us all about ethical AI, data protection, and why it matters. So, Professor Savidis, I'll see you shortly in segment 2.
Thank you very much. See you soon.
See you soon, and we will open the first part of the show with Stefanos Pavlidis. So, Dr. Pavlidis, tell us a little bit about the challenges that the healthcare sector is facing, and you have personal experience yourself as you're an entrepreneur in this field from the COVID days until recently, so the past 5+ years or more. So, what are the challenges both for patients or for the business as well?
So good morning, Chryssa. Thanks for the introduction and thanks for having me. So let's try to simplify things. The biggest frustration in the AI, in the healthcare nowadays, is the frustration of getting in touch with the healthcare itself, the doctors, the clinical laboratories, the clinics, just to make an appointment, and in general, various questions. So let's give some numbers. 6 out of 10 people, they hang up before the 1 minute waiting time. They cannot wait on hold. Then most of the people in 2 minutes, they are gone. You don't see them again. So, and some of them hang up immediately. A typical clinic or a healthcare provider receives about 2,000 calls per day. So if they miss 140 out of every single day, that's about 50,000 people every year. That's that they couldn't get any help at all. So the sad part is that 85% of them, they will never call back. So they will try to find that help from somewhere else or just don't do nothing. So this isn't just annoying. It costs money and, more importantly, delays care for people who really need it. We have tried everything. We added more stuff. We have expanded robotic phone menus, online booking, but nothing gives people instant help when they need it. So the 24/7 AI voice agent, frictionless access to healthcare, it's the way to go forward.
We talk often about human-centric technology and human-centric AI. How important is this human-like touch and human centricity of all these AI innovations?
So basically, the way AI is built, it's to have a human tone, a human way of communicating with patients or in general people. It understands emotion, and it can basically answers like you and me now. It can answer any question or the questions that they are assigned to answer, because if they don't know, they don't answer. And this facilitates the communication. It can book you an appointment and then send you a message on your mobile that your appointment will be on the day that you have decided. Just now with the AI voice agent, it can give you directions. It can give you any kind of information that we as healthcare, we decided what will be available for the customers. So 8 out of 10 people are basically calling for basic questions, directions, and make an appointment. 20%, 10 to 20% of the people calling, they might need a little bit more attention. They might need a human judgment. In that case, in those cases, the AI voice agent can understand this and can direct the phone call to a human, a real human, who can take over and fix the issue and satisfy the side of the patient.
Let's imagine the future of healthcare. How do you envision AI use in healthcare in the coming years? Last week, George Halkedakis, the CEO and co-founder of Kalimera.ai, said that in AI terms, 5 years is like 10,000 years. So how far you as a scientist, as a researcher, a person who writes a lot, you have many publications, you like to dig in and think about the current but also the future applications. How do you envision AI in the future? Apart from appointment booking, what other use cases we are starting to see now, and you're predicting that they will be very big and important in the future, and therefore it's important to already invest in those?
So let's put things in perspective. Healthcare is becoming preventative, predictive, and personalized. To be able to catch problems early before people get sick. The AI voice agent is the backbone of this transformation. I couldn't say this simpler than that, because with the AI voice agent facilitating the communication, it's a must way where alleviates the pain or the stress of the people when they are calling, and they have no waiting times. They have no music waiting time. They are not on hold. They don't have missed calls, and they get answers immediately. They can book their appointment based on the availability. They can ask any question that healthcare allows and control the AI voice agent to provide any possible answer and alleviate the pain. And when the people need to call, they can call, arrange their appointment, and then move on with the doctor suggestion of prescription or clinical diagnosis. So it facilitates the communication. This is the biggest advantage.
Mm-hmm. So it facilitates the communication on this first part of the journey. How about when the patient is visiting the doctor? Because I could see a great use of voice AI, for instance, in note taking, and when the patient is being examined by the doctor, they could. Of course, I would like to ask the question to Chryssa in terms of the safety of this medical sensitive data. I notice often, depending, of course, on the country, that the doctors perhaps do not keep such a clear medical record for their patients. Depends again on the country. So do you see that voice AI could be used for these purposes?
So the voice AI and basically the AI in the healthcare sector, these systems will connect in the future with wearables and lab data with the CRM. It can recognize who's calling based on the connection with the CRM. So it spots early signs of disease because it's more organized. The AI becomes a helpful assistant to the doctors, to the patients, keeping everything organized, reminding you what's next, making sure nothing falls through the cracks, and facilitates healthcare to catch problems early and not late. For example, it can even call a patient, remind them that they need to make their sugar test and diabetic. There are a list of diabetics, we know who they are. So the healthcare can basically remind them that they need to do their sugar test, they need to see the doctor at this time, their results will be connected and live onto the mobile of their doctors, and then the doctor can really have a real access of the patient, almost live.
And that's great because we have still the human oversight. We have the doctors, the medical doctors, right? And we have technology assisting so that, as you very well said, not to miss anything. Because of course humans can make errors and maybe the data is so vast, but is that where you see the cooperation between the technology and the human oversight on the other hand?
Yeah, exactly. So we have the direct, the bridging and filling the cracks where patients and healthcare will be in a direct, almost real, connected, where nothing left behind, and that's very, very crucial. So safety is everything. Somebody, as you mentioned earlier, that what about the way they communicate? So, for example, we have the AI agent receiving all these phone calls, having people asking various questions. How do we secure this information? We use more than 20 AI AI models that are checking each other, and in parallel, at real time, every bit of information that comes out, it's controlled, it's encrypted and secure. Every interaction, it's double-checked, triple-checked, because we have these AI models running in parallel while the patient and the AI voice agent communicates. So, and in addition, another level on top of this, we have the HIPAA and GDPR compliant, where Dr. Chryssa will elaborate even further to explain us how this is into account with the AI voice agent. So following all the privacy laws and all bits of information are watched constantly. And in a matter of hallucination that we observe in other models in everyday life.
And hallucinations is something definitely we don't want when it comes to our medical data and healthcare, right?
It's unacceptable in healthcare. When AI invents information, this is not acceptable. That's why we figure out we spend more than 2 million euros just making sure that it's safe because the healthcare cannot cut corners. We validate and we have real time crossing and double checking and triple checking all information coming out from AI voice agent. And in parallel, we have the real humans on the backstage following the transcripts, the recording, the communication, and seeing where are the clinches to make it even better. So over time, it's like a tool that only gets better. It's like a dream tool.
Great. So I would like to thank at this point Dr. Pavlidis, Stefanos Pavlidis. Is there anything else you would like to add before I move on to our legal expert for today's show? Is there something else, Dr. Pavlidis, on top of your mind?
Thank you for giving me the chance to conclude. So the AI is not replacing doctors or nurses or in general human beings. It's just removing the frustrating parts, the waiting, the phone tag, the confusion. And so you can get immediate answers, no missed calls, real people available when truly need them. And in healthcare, basically it can work 24/7. Morning, noon, and midnight. The result is simple, no missed calls, no confusion, no delay, just safe, accessible, human-centered healthcare 24/7. So this is what AI voice agent can be for us.
Excellent. And I see your passion and I see that you know what you're talking about. Everybody watching us right now, I want you to stay tuned, not only for segment 2, where Professor Chryssa Skodra is opening up the legal frameworks and principles that govern this matter at hand, we're discussing today. But Stefanos, please stay with me. At the end, we will show you a live demo in Cypriot Greek and in English. So stay tuned for a live demonstration with Dr. Stefanos Savvidis. So, Dr. Savvidis, I'll see you shortly at the end of the show. I'll welcome now in the studio the professor. We spoke about Chryssa Skodra. Welcome.
Hi again. Hi again. So thanks for having me.
Thank you. Pleasure is mine. I appreciate so much your time. You're both experts and busy people. So thank you for giving your insights here today for all our viewers. I think there's value in that, to have people who understand healthcare, who understand the business, who understand the customer issues, challenges, and also the law. So you are the expert to open up the legal framework of things. So first of all, towards the end of the first segment, Stefanos mentioned about the hallucinations and so on. I want to ask your opinion as well, but set again the stage for us. Healthcare, when we talk about healthcare, it's very sensitive topic. It's about our personal health, medical data. These are of utmost importance for every individual, every person. So what are the legal frameworks that govern the protection of our data and connected to voice AI or AI in general? So give us a little bit the framework when it comes to how companies are protected, but also how end users and patients are protected from the legal standpoint.
Yes. Well, definitely Stefanos gave a very good presentation of the bigger picture when it comes to healthcare and AI. And if we want to keep it simple, it's clear that the combination of the two does not give any room for mistakes. And that is so clear, not only in practice, but also in the legal frameworks. So, and the reason is because in healthcare, AI voice agents are covered by very strict privacy laws. In the European Union particularly, we have the General Data Protection Regulation, the so-called GDPR, and the AI Act, where both of them require, first of all, lawful collection and use of data, transparency, human oversight, which is very, very critical here, and apparently extra protection for health data. And I'll give you an example. For instance, if an AI voice agent helps diagnose medical conditions or interacts with patients about their health, that is explicitly classified as high risk task, right? So this means that the company must first explain how the system works. It's not just black box decisions. Secondly, the company must keep detailed documentation and logs. Third, we must have human oversight and also undergo conformity assessments before we launch whatever product we want to launch. So a healthcare AI isn't just a smart tool. It must also be transparent, traceable, and accountable before it goes to the patients. And for companies specifically, this means in practice that they use data only when necessary, encrypting data, getting clear consent from patients, and running data protection checks, and of course sign safe contracts with their partners. And going to the other side, the users or the patients, definitely they need to retain control over the access, correction, or delete of their data. And that means also that they have the right at any given time to maximum security and confidentiality. So this is the legal framework, at least from a European Union perspective.
Mm-hmm. So you explained the frameworks and touched upon on the principles that guide those frameworks as well. When we talk about Kalimera.ai and its use cases and applications for their clients, how compliant and how are these principles taken into consideration?
Yes. Based on what I have just explained to you about the legal frameworks, it's not just an option for Kalimera.ai, it's mandatory to follow global standards for data security and responsible AI, and that means effectively they need to show the maximum attention to privacy and risk management issues, but also from ethical use of technology. And that this challenge also must be seen along the core principles that come with, I would say, modern laws, modern legislations that we have recently, let's say, seen coming out of from the European Union, from even from governments, from countries, where the constant, let's say, challenge is to balance innovation with people's rights. And going back to the principles, apart from the obvious that has to do with accountability and transparency, those that I explained before, and of course the data quality, and Stefanos touched on this point very accurately, that we should place a lot of effort to control the quality of data in order to be accurate, unbiased, and of course collected lawfully. But I will address a very important issue here, which is also a principle that governs the data and the use of AI, which is the cross-border protection. This is not new, of course. It is, I would say, an all-time classic challenge when it comes to the European Union under the framework of GDPR. And that refers to the movement of data across countries, and not only across the 27 member states of the European Union. That's the easy part, but especially when they go to third countries. That requires very detailed, very secure legal frameworks, and it is the responsibility of the companies. And this is what Kalimera.ai is doing. And believe me, we place a lot of effort to keep ourselves up to date on this particular issue when we have data moving, for example, in the US or Asian countries or anywhere else outside the European Union.
Yeah, I was wondering about that. So every, as you mentioned, the EU regulations and legal frameworks, are they perhaps a bit stricter than what happens in other places? Or how do you see that the legal framework is being applied across the world, and how we can synthesize and which laws govern what? Because is there a universal AI approach? Perhaps some countries are doing stricter or better than others. So what's your take on this?
Yes. Well, let me start by saying that, first of all, we do not have, and I think that it's impossible to have a universal, let's say, AI legislation. And I'm quite, let's say, confident that this is not the target. This is not the goal, to create something universal. For many reasons, and this doesn't have to do with the particular technology or any specific sector. Trying to invest resources and time creating something universal, for me, it's pointless. What we should do is to find the right way to inform people, and of course to try and educate sometimes and advise policymakers that when things actually become challenging, when we have this cross-border movement of data. You are right when you say that EU appears to have the toughest and most detailed rules in AI. This is not new, to be honest, when it comes to the European Union. European Union, just for your information, has been criticized a lot for many other things when it comes to regulation, and it has been criticized for over-regulation and over-bureaucracy when it comes to these things. But I think in this particular case, the EU appears to have, for me at least, and this is my personal opinion, a very comprehensive, a good comprehensive legal framework here. It's not just the principles that I described before about transparency and accountability through GDPR and AI Act. It's also a matter of, let's say, more solid and across all sectors, right approach for controlling data and also controlling the way that we use AI to make sure that the use of AI is also safe and effective. Now, I'll give you an example. The legal framework in the European Union is the one that I described before about GDPR and AI Act, where voice agents, for example, that handle personal or biometric data are classified as high risk, and therefore they need full compliance documentation, full stop. And that goes across all sectors. Now, elsewhere, rules appear to be rather lighter and more sector-based. In the US, for example, what we see is that they rely more on ethical principles, industry codes, rather than one unified framework. I understand that for specific reasons, this might look a bit more, let's say, targeted oriented. But if we try and see the bigger picture, sometimes we might experience some sort of inconsistencies. I'm not saying that EU framework is better than others, but I'm just addressing this as a fact. The FDA in the US, the Food and Drug Administration, regulates, for example, medical devices, including those using AI or other technologies like machine learning, to make sure that they are safe and effective. So they regulate medical devices. When it comes to the consumers and patients and people, then we have a different set of rules coming from FTC, the Federal Trade Commission, who they try to ensure companies using AI don't engage in false, deceptive, or unfair practices. So we have this kind of multiple layer of, let's say, policy making in the US, which is something that we need to address, because for companies and for all of us that we want to explore further and see what is happening outside the EU, we should be aware of this if we want to move and engage in these countries further and be legally safe.
Mm-hmm. One question that popped into my mind is how you're teaching at the University of Nicosia, correct?
Correct.
So do you teach these topics to your students, the students who study law and they will be soon practicing law? So my first question is, what do the young aspiring lawyers know about the AI Act, about these developments? Because often they accuse the educational systems globally that they're perhaps teaching old stuff and old knowledge. So you're a university lecturer. What is the new generation of lawyers to know about all these developments currently?
Yeah. Well, first of all, I have to say that I'm very pleased and very honored that I am a member of the University of Nicosia, which is a university that has demonstrated many times so far that we want to not only study and research new technologies, but at the same time to practice these and equip our students with whatever skills are necessary in order to get out into, when they come out of the university and get into the industries, to be equipped with the right mentality, first of all, and the right skill set to survive and develop their career further. And also I'm a member of the Institute for the Future of the University of Nicosia. And the purpose of this institute has to do specifically with new technologies like blockchain, AI, robotics, and many others. So that gives me the opportunity to interact on a daily basis with, first of all, our students and their needs, their concerns about their future when they get out of the university. But at the same time, with the industry, when it comes to measure their needs, their future needs, what exactly they need in terms of labor, in terms of employees, what kind of skills they are looking they want their employees to have. So to answer your question, yes, this is something that we do, and we do this with the maximum, believe me, with the maximum attention and interest from all of us, all faculty members in the university, because we want to cultivate, let's say, the mindset and the culture to our students that it's not bad to use ChatGPT, for example, or any other tools, AI tools. On the contrary, they have to use those. Those are tools. But they have to train themselves to use those in the right way. It's not a substitute of knowledge. It is a tool that makes their lives and their career, of course, easier when it comes to the production of quality work. They need to be careful. They need to think very well, and they need to examine in which context they want to use those tools. And in the end of the day, by learning using those tools in their jobs, this is going to give them a competitive advantage compared to others that either they refuse or they don't know, they don't interest to use those tools. That is a must for the coming generations.
Excellent. Thank you so much, Professor Haris Savidis. I know you have an appointment to attend to. I believe we covered a lot, mainly in the healthcare industry, but also from your field, from the legal perspective, also the education of the legal aspects to the younger generation. So if you're tuning in and listening, you learned a lot how important it is to have the legal understanding and also the ethical understanding and common sense at the end of the day. I think vital skills for every business, every professional working nowadays in any organization. Thank you so much. Is there anything you'd like to add that we haven't touched upon?
No, it was pleasure, and I'm always very, very happy when I have these kind of interviews and these presentations. I'm very honored. I really feel very honored that I work with people in Kalimera.ai, and this is something that, for me, it's the kind of the epitome when it comes to combining, the knowledge, the theory, and the practice in AI, and with all these things that we cover: legal, technical, ethical, everything. So it's thank you very much for having us. Congratulations.
I'll bring here your colleague. Thank you, Haris, for your insights. I'll let you continue with your busy day.
Thank you very much.
Thank you. And now we are back, as we promised, with Stefanos. Dr. Stefanos Pavlidis is here with me. We promised a live demo. Are we ready now to go check out how patients, how users can really receive AI assistance 24/7 in a variety of languages?
So thank you very much, Chryssa. So let's try to do our demo. I'm just going to call a line. And
let's start first with Cypriot Greek, right?
Okay. Let's see. Yeah.
And then we will go to an English demo. So we'll give you two live demos. We see one language that is more of a rare language, a rare dialect. It's a dialect of Greek, spoken by...
Let's go. Καλημέρα σας. Καλημέρα, μπορώ να κλείσω ραντεβού για εξετάσεις?
Για ποια εξέταση ενδιαφέρεστε?
Θα ήθελα να κάνω ένα
MRI γονάτου.
Είναι εύκολο?
Καταλαβαίνω. Ενδιαφέρεστε για μια μαγνητική τομογραφία γονάτου.
Ναι, πολύ σωστά.
Σε ποια πόλη θα θέλατε?
Στην Ξάνθη. Είναι εύκολο στη Ξάνθη?
Ναι, η μαγνητική τομογραφία είναι διαθέσιμη στην Ξάνθη. Το εργαστήριο βρίσκεται στη διεύθυνση Γεωργίου Κονδύλη 46 με 48.
Ωραία. Μπορούμε να πούμε για Δευτέρα, η ώρα 9 το πρωί?
Θα θα χρειαστεί να συλλέξω πρώτα τα στοιχεία σας για να προχωρήσω.
Παρακαλώ.
Μπορείτε να... Παρακαλώ, πείτε μου το όνομά σας και το επώνυμό σας.
Στέφανος Παυλίδης.
Ευχαριστώ, κύριε Παυλίδη. Παρακαλώ, δώστε μου τον αριθμό επικοινωνίας σας σε διάδοση.
Ευχαριστώ πάρα πολύ, ευχαριστώ.
And now let's check out a live demo in English. Stefanos, are you ready?
Yeah, let's try the English demo where we can try to book an appointment. Just a moment. So let's see. It's on speaker.
Καλημέρα. Καλώς ήρθατε στο Kalimera.ai. Είμαι ο Σάνι, ο φωνητικός
Kalimera.
AI.
Can we speak in English?
Good morning. Of course, we can continue in English. How can I assist you today?
So I would
Please
like
let me know which agent you would like.
I would like to speak with the healthcare department, and I would like to book an MRI.
I'm connecting you to the India Healthcare Department, who will be better able to help with your request to book an MRI. Please wait a moment.
Hello there.
Hi.
I'm here to assist you with booking your MRI.
Yes, can I book an MRI for my knee?
Of course. I'd be happy to help you with that. Could you please let me know your full name and
Stefanos
your preferred date?
Stefanos Pavlidis.
Stefanos Pavlidis. Got it. When would you like to schedule your MRI?
Can I
And
book
which
it
location is most
Monday at 9 o'clock in the morning?
Sure thing. We have several locations available.
Okay, let's book in Nicosia. Nicosia, please.
Great choice. I'll book your MRI appointment in Nicosia for Monday at 9 o'clock in the morning.
Okay.
Let's confirm
Thank
all
you.
the details.
Sure.
You're welcome. If you need any more assistance, feel free to reach out.
Thanks.
Have a great day.
So we probably call in a Cyprus phone call line, and the appointment is booked for Monday in Nicosia.
So you can see from the segment of this how many seconds it took to really have the phone call started until you got your appointment. So that's only less than 3 minutes. So less than 3 minutes according here to my data. So it took 3 minutes to book the appointment in one city in Nicosia where there were available facilities. Thank you so much, Stefanos, for demonstrating this. And as you said earlier in the show, most people, if they wouldn't get through the line or they would listen to a repetitive tune again and again, they might close that line. They might be frustrated. They're thinking, oh, I have something I need to check. It's about my health. I'm a bit anxious now and I'm not getting through. I don't want to pay for listening to a tune on the replay. So in less than 3 minutes, you managed to get your appointment if you were to proceed. Excellent.
Thank you, Chryssa. Thank you very much for your time, and thank you very much for inviting me. I really
Thank you for this
that.
great demonstration. So we just listen now. What is the future of healthcare, or the present and the future? How AI can safely be deployed in healthcare environment throughout the customer journey. Now we just listen how a patient can call a healthcare facility and proceed with a very fast appointment booking. Thank you for watching. This is Voice AI Insights, a special podcast series powered by Kalimera.ai. Thank you for watching, and I'll see you next time. Stay safe, stay tuned for more insights. Bye.